Join Health Click on an educational journey into a systematic evidence-based evaluation and treatment approach to the injured runner.
This course is designed to help you evaluate and treat injured runners from a comprehensive standpoint. The reason my techniques work is that they combine the latest in evidence-based practice along with my experience as a runner and as a clinician to help maximize my patient's ability to get back to running as quickly as possible. I'm not a physical therapist who uses a lot of gimmicks. I don't use a lot of fads that are out there to try to treat injured runners. The reason my approach works is because it is tested and it is tried and it is true. You take the latest in evidence, you apply it to the patient in front of you, you listen to your patient, you listen to what their goals are, and you combine that with your experience, and that's evidence-based practice. The thing that's unique about me is that I'm always evolving as a clinician. We know the literature changes so frequently that it's my job to stay up on it. So the things I practice now are completely different than the way I practiced 5 to 10 years ago. And I hope this course gives you the latest information on how to treat several running injuries, but also have the foundation of understanding running biomechanics, understanding anatomy, understanding exercise science, and to put it all together so that you can apply what you learn through this course to best evaluate and treat your runners to get them back out on the road as quickly, as safely, and as efficiently as possible.
This course prepares the clinician to be proficient in understanding the components involved in the individual runner's gait, while identifying specific areas of deficits that can lead to injuries. Through a systematic evaluation process, the clinician will develop an individualized treatment approach to optimize a runner's performance. The most up-to-date clinical and evidence-based information on evaluating and treating an injured runner is presented, and a hypothesis-driven evaluation approach is introduced and demonstrated throughout this course. The specific subject analysis presented in this course will assist the clinician with establishing a process to find the root cause of the runner's dysfunction. This baseline information provides the foundation for the comprehensive functional evaluations and treatment programs individualized for each runner. The clinician's understanding of the diagnosis, literature, running biomechanics, and responses to the key questions from the subjective examination leads to a targeted approach to the individualized evaluation process. The instructor describes and demonstrates each phase of testing that leads to the next phase in this inverted pyramid of evaluation. Once the information is gathered from the previous questions and tests, the clinician can rule out any sources of dysfunction coming from the spine, hip, knee, or ankle. Throughout this course, the instructor stresses the importance of correlating each test to the biomechanics and functional anatomy of the runner, and the importance of specific joint mobility, muscle strength, and movements needed for healthy running biomechanics. This course provides you the essential tools needed to develop a comprehensive, individualized, targeted rehabilitation program for each of your running clients.